Hi, everyone. I'm very sorry for being late. We had a urgent meeting that started at 4 and just it still is going on, but I had to leave it. Um, um, it was just a conflict for today. It's not going to happen again. I apologize. Je m'excuse pour le retard. On avait une réunion d'urgence à 4 heures. En effet, ça continue, mais j'ai quitté pour qu'on puisse faire ces conférences de presse. So let's start. I want to start with Ontario numbers, 3,682 cases increased from yesterday again, seemingly a flattening or leveling off of the numbers. It's the second time we're in the 3,000 range. As you know, we peaked at over 4,800 last week. And so it looks like there is a slight sort of tapering off of that wave, albeit the numbers of hospitalizations and ICU admissions continues to go up provincially. We've got 806 admissions provincially in ICU. And we do expect there will be a lag. So for every case that we have now that's positive today, there might be an increase in admissions in a week or so. So again, that's why we need to wait another couple of weeks to see how those trends will follow. Will follow. They usually is about a week or so behind. In terms of our numbers locally, we continue to add cases. Again, this time we've added a total of 34, 11 in Akwesasne, 10 in Cornwall, 5 in SDNG, and 8 in Prescott Russell. And these are lower numbers than we've seen in the last couple of days, which is good. In terms of our rolling average, again, you could see that we're actually on the way down. So we had a bit of a flattening here, and now we're actually down. For Cornwall is still higher, but again going down, and our average is still way above the red. But I'm encouraged that we're seeing this downwards, and I'm hoping that is a trend that will continue moving forward as we continue our tracking of the cases and how they respond to the current public health measures that are out there at this point in time. In terms of other the hospitalizations that you saw over there, we had 31 hospitalized with. Forgot to see the number actually. I'm just going to look it up right now. I was going to pay attention to that. We have 28 hospitalized and 6 in the ICU, so it's a bit of a lower number in that regard. We continue to, we've actually added 2 deaths over the last couple of days, both in the community. That's where our deaths are up to 96. Unfortunately, again, 1 death too many every time we add one. So in terms of our outbreaks, we continue to have some outbreaks in multiple areas. Again, minimal in retirement homes and long-term care residents. The Maxwell Manor was declared over today. And when we, based on new guidelines as well, sometimes we like I said, we have the ability now to have suspect outbreaks and so on in multiple areas. And so what I'm seeing here is, again, a couple of cases where we've had 1 or 2 residents. St. Matthew Retirement Home has 10 active there, and we're following that as well. But again, the number of long-term care retirement homes outbreaks has been falling over the last while, which is a testament to the vaccination of that age group as well. So one of the things that I just want to start talking about right now is again our vaccines, and we again added several thousand vaccines from yesterday to today. As a matter of fact, we in our clinic, 2 clinics yesterday, we added close to 2,000 vaccines and a few others that are from the hospitals and so on. And as I said, we've got multiple venues now, multiple areas where we're showing the vaccine, where we're distributing the vaccine. We are continuing our clinics all the way through to the second week of May right now. We've got 22,000 booked at that point. Actually, the meeting that we had now was about vaccine allocation. We are told that we're going to be getting our allocations for the next month on Saturday. We're told also that there's going to be a significant increase in the Pfizer allocations. So we're looking forward to getting those and planning more clinics. We're also looking at potentially what age bands might be decreased. Again, nothing is official, but those are what we're looking at. And I do suspect that from what I'm seeing and what I'm hearing, that pregnant women will also be added to the high risk conditions for vaccination. Stay tuned for that. But I do know that the Obstetrical Society has recommended that. There seems to be a disproportionate number of pregnant women in ICUs and being affected. Not surprising, we have the same type of vulnerability with other respiratory viruses, including the flu and including H1N1. So stay tuned for that. I think there's going to be some formal announcement, but I'm suspecting just from what I'm seeing and what we're seeing in hospitals. I know that in Ottawa there's several cases, and across the province there are multiple cases of women who are otherwise well and pregnant and have complications and require admission to the hospital, many of which require ICU admissions as well. So stay tuned for that. We're also looking at, again, we're bracing ourselves for moving forward is those increased numbers. So then we can start looking at other, like I said, other age groups, other workers that cannot work from home, including daycare teachers and so on. Again, that's all contingent upon receiving those doses. So like I said, we'll get confirmation. And the meeting today was just to give us a heads up that we're going to be getting extra doses, and that those categories and expansion of eligibility will occur over the next week or so. So we'll stay tuned for that. We do have a meeting on Saturday where we'll be actually given our final sort of more definitive allocations and allocation increases into that. Donc, bonjour tout le monde. Je vais commencer avec les chiffres antérieurs. On est rendu à 3682 de cas de plus aujourd'hui que le jour avant. Ça, c'est une bonne... c'est encore haut, mais si on voit qu'on a un plafonnement, la semaine passée, je pense qu'on avait des 4800 à peu près. On a resté dans les 4000 et ça, c'est la deuxième fois dans cette semaine qu'on a eu des chiffres dans les 3000. Donc, à mon avis, on voit le début d'un plafonnement de la courbe. On ne voit pas les augmentations importantes. Par contre, c'est un peu trop tôt à dire, mais on voit toujours une augmentation des cas à l'urgence, aux soins intensifs et aux admissions à travers l'Ontario, surtout aux soins intensifs. Et ceci, à mon avis, malgré qu'on voit une diminution des cas, les cas qui sont admis aujourd'hui, ils représentent les cas qui étaient positifs la semaine passée, parce que ça prend à peu près quelques jours de développer des symptômes, etc., et de détériorer de façon pour que vous serez admis à l'hôpital. Donc, je suis un peu optimiste, mais je veux voir aussi que ce plafonnement et la diminution graduelle va continuer. Malgré qu'on voit que les taux d'admission aux soins intensifs, surtout, ne va pas diminuer encore, mais je m'attends qu'il va y avoir un délai dans la diminution au niveau de décroissance des cas dans soins intensifs. Au niveau de nos cas en total, attendez, c'est pas celle-là que je veux. Où est-ce que j'étais? Attendez, voilà. Donc, aussi, on a changé
Dr. Paul, I'm very sorry to interrupt. Désolé de vous interrompre. Ce n'est pas l'écran que nous voyons, nous.
Attendez, je vais fermer cela. Attendez. It always happens. Oh, voilà, merci. Ça arrive toujours, je ne sais pas pourquoi avec Zoom, des fois, je choisis. En tout cas, we're back. Donc, voilà, on voit, Jenna, le 461 qu'on voit ici.
Oui, c'est bien ça, merci.
Merci. Donc, nous avons 461 cas actifs, 28 à l'hôpital, 6 aux soins intensifs. Ces chiffres sont diminués. On a augmenté 2 cas de décès, malheureusement, il y a quelques jours. Donc, on est rendu à 96 décès en total dans notre région. Nous avons 17 flambées, mais la plupart ne sont pas dans la maison de retraite ou dans la maison de longue durée. Et bien sûr, si on voit au niveau des changements, on voit que nous avons ajouté en total 34, 11 vient de Akwesasne, Cornwall 10, SDNG 5 et Prescott Russell 8. Puis en comparaison, cette diminution des cas qu'on est habitué, d'habitude, on en rajoute 20, 30, soit à Cornwall ou Prescott Russell ou SDNG. Donc, je pense qu'on voit, et surtout qu'on peut voir dans les moyennes mobiles, on voit, voilà, on a un plafonnement ici. On voit nettement une diminution des cas. Ça, c'est des cas de la moyenne de 7 jours sur 100 000 personnes. Donc, vous voyez, on est toujours plus haut que la rouge ici et l'orange là, mais quand même, on voit qu'on va dans la bonne direction. J'espère que ceci peut continuer. Je m'attendais qu'on verrait 2 semaines après le Pâques, qu'on verrait peut-être la diminution. Donc, on le voit. J'espère que ça va continuer avec toutes les précautions qu'on prend au niveau les mesures de santé publique qui sont en place actuellement. Au niveau des vaccins, on est rendu à presque 47 500, presque 48 000 parce qu'on n'a pas tous les vaccins comptés dans ça. Hier, nous avons vacciné juste dans nos 2 cliniques 2000 personnes et on continue aujourd'hui, on continue demain. Nous avons des cliniques jusqu'au deuxième semaine de mai. Déjà, nous avons 22 000 réservations de bouquets et nous avons eu la bonne nouvelle aujourd'hui que en effet, les raisons pour lesquelles j'étais un peu en retard pour cette conférence de presse, nous avons eu des nouvelles qu'on va recevoir beaucoup plus. En effet, d'où le montant que Ontario va recevoir de Pfizer va doubler en mois de mai et un peu plus à la fin du mai aussi. Donc, on se fait dire que on va se préparer pour la semaine prochaine, peut-être à diminuer l'âge d'éligibilité et peut-être ajouter des personnes qui sont les premiers répondeurs, les personnes qui ne pourront pas travailler dans leur foyer, etc. On va l'ajouter. C'est à suivre, mais c'est pour ça qu'on a la réunion aujourd'hui, juste pour nous donner une mise à jour au niveau que ce qu'on peut attendre. Samedi, on en a une réunion et on va avoir à ce moment-là beaucoup de détails. Je peux vous dire aussi qu'on continue à vacciner dans notre région. On a bien sûr nos hôpitaux, on a bien sûr, on commence à avoir une chiffre augmentant avec les soins primaires qui ont les vaccins. Ainsi, nous avons nos cliniques mobiles qui visitent, qui font les maisons de groupe, etc. Et aussi, on vaccine les maisons à la domicile, les personnes à la domicile aussi. Donc, l'autre chose que je voudrais juste dire, c'est que je pense que demain, il va y avoir une annonce. Je m'attends à ça parce que qu'est-ce qu'on a observé? Ça fait à peu près un mois qu'on voit plus en plus les femmes enceintes qui sont admises à l'hôpital et aux soins intensifs. Donc, semble-t-il qu'il y a un risque quand on est enceinte d'avoir des complications importantes de COVID-19. Ça ne me surprend pas parce qu'on voit le même type de complications chez les femmes enceintes qui sont atteintes d'influenza ou H1N1 il y a 10 ans. Donc, ça ne me surprend pas. Donc, je m'attends parce qu'il y avait une annonce de la Société d'obstétriciens et gynécologues de Canada qu'il faut qu'on vaccine les personnes enceintes, les femmes enceintes. Donc, je m'attends que d'ici demain matin, on va avoir une nouvelle direction d'ajouter les femmes enceintes comme le risque le plus élevé au niveau des conditions médicales pour qu'ils puissent seront éligibles tout de suite, dès demain, pour le vaccin. C'est à suivre, mais je m'attends à ça. Ainsi, on s'attend peut-être la semaine prochaine d'ajouter, là, peut-être aller à 55 ans. Ce n'est pas officiel encore et tout ça se base sur le fait que nous allons recevoir plus de vaccins en commencement la première semaine de mai, mais c'est une chose à suivre. So I'm just going to answer some of the questions here, and we'll move forward to questions by the media. Oh, I just wanted to say, and I'll say it in French as well, that in addition, some of the changes that we've had, as you know, that for Indigenous populations living in urban areas off reserve, initially the age group was 55 and over. Right now, we have gone 18 and over. Anybody who was 18 and over who was First Nations living off a reserve, living in an urban area, can pre-register on our website for that as well. Donc, je veux juste dire que les personnes, les autochtones qui demeurent dans les villes ou dans les régions urbaines sont éligibles dès aujourd'hui, 18 ans et plus, d'avoir leur vaccin aussi. Il s'agit à se faire préenregistrer sur nos sites web. J'ai une autre question ici. Est-ce que c'est possible de l'os qu'on a de Prescott Russell? En effet, nous avons eu quelques flambées, mais la plupart des cas que je viens de voir, tous les cas qu'on a eu en mode depuis mi-mars, Prescott Russell, sont malgré qui commencent peut-être à une flambée au travail, etc. La plupart sont propagés à la maison. Donc, ça continue comme ça. I have another one from CTV. What is the COVID rate per capita in our area, in Cornwall and area? At this point, our rate is 1,958 per 100,000. That compares with 2,911 per 100,000 provincially. And if you look at the Cornwall area, it's about 2,500 per. So there's a bit of higher incidence in the Cornwall area based on those numbers. James from the review asks me, are business owners who are staying open when they're not supposed to be fined? Yes, they are. As a matter of fact, we are we are doing expanded enforcement on some businesses that are still opened despite the current orders. I have another question here. The current state of emergency and stay-at-home orders came into effect 2 weeks ago today. Any suggestion of why our new case counts are by and large not dropping off? Well, they're starting to drop off. So I was expecting a 2 week or so. So let's hope that it goes into that right direction. So Jenna, that's it. We're opening it up to questions, please.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul. According to the health unit statistics, there's been about 47,000 doses, a little bit more than that, of vaccine administered so far since you started giving out vaccines. During yesterday's meeting at SDG Counties, you said that you had to give vaccines to anyone who lives in Ontario. That's the provincial directive. Can you provide some detailed stats or even some remotely detailed stats about how many people who live in the EOHU have received 1 dose or 2 doses?
I would tell you that from the most of the people that we vaccinated are from our area. I can tell you off the top of my head, it's maybe a couple of hundred that are from outside our area, so it doesn't really change. Of those, it's off the top of my head, and I can get them for you though. I would estimate that about 4,000 have received both doses, and about 43 to 44,000, 42 to 43,000 have received for just one.
Okay, great. Thank you. Now, again, to the county council meeting yesterday, MPP Jim McDonnell kept talking about numbers per capita. We're getting the number of vaccines per capita and the pharmacy delivery on a per capita basis. Can you comment if it's true that on a per capita basis, compared to other public health units in Ontario, that we are getting the same per capita basis as these other places?
I can tell you that I don't have a vision of the Astra because we don't have those statistics yet. I'm asking for them. But the allocations that we've got, I can tell you that we are now at par, actually, if not more than most health units in Ontario. But we've caught up, and that was much to my dismay before, because as you know, we were lower than others, much lower. So we've caught up with a reallocation and sort of the supply that we got this week, and I saw them. I can tell you that we are on the upper edge of the allocations per 100,000.
And have you had your allotments adjusted downward because of any kind of vaccine reorienting
No.
like towards Toronto or other hotspots?
No. They initially were put. They were all health units were brought down by a couple of trays. When I say a tray, each tray is about 1,000 doses, and we were actually we received a bigger dosage supply this week that made up for it. That actually added a bit more. That brought us up to being at par, if not higher than the average health unit. So I'm quite happy about that.
Okay, great. Thank you very much.
You're welcome.
Next question, Matthew Kupfer, CBC Ottawa. Please go ahead.
Hi, Dr. Paul. Can you hear me okay?
Yes, I can.
All right. I had an issue yesterday. Just to start off, I hope this is an okay question to put to you, but obviously the pressure on hospitals is something that we've been hearing a lot about in different regions, the transfer of patients between regions, and even patients being transferred more than once. Can you paint a picture at all of what the situation is like for the hospitals in your region, whether they're in any kind of receiving mode now, or they're feeling a little bit more of the strain as other hospitals are reaching and surpassing capacity closer and closer?
For the most part, like I said, I can't speak on behalf of the hospitals, but I did speak to the CEO of our Cornwall hospital, because that's the one that's most affected. Most of our admissions are there right now. And I do know that up until yesterday, they were not receiving patients from other areas, but they're starting to. So there is a bit of overflow of those hospitals. I know that the Cornwall hospital has limited capacity to accept more, because they have, at this point, I can tell you, I had the number somewhere here. They have a significant number of COVID patients right now on their wards and in the ICU. So it's a matter of their capacity being able to take care of the ones that they have. But I do know that they had received some from other areas, but not that many, because they were already overwhelmed. Just to give you an example, right now we have 19 of our local people in hospital at the Cornwall Hospital right now, and 3 are in the ICU there, and they've got some other patients in the ICU. So they have been working at about 115 to 120% capacity. So I do know that they have a limited capacity to receive, because they're overwhelmed as well. I'm talking about the Cornwall Hospital. I can't speak about the other ones, because the Cornwall one is the one that's been the designated COVID hospital in our area.
Okay, and I think you were kind of sharing some good news about vaccines, it sounds like. And I was wondering if, you talked about the prioritization perhaps of pregnant women and other groups, not just age groups. I guess just in terms of what you hope are the prioritized groups if vaccine eligibility is set to expand, can you kind of make the case for where you'd like to see those prioritized groups go?
Yes. First of all, I'd like to see people 50 and over get vaccinated. And I'll tell you the reason why, because it's risk. And the risk is I'm seeing the patients in hospital right now in the ICU and people that have died. Actually, we had a 51-year-old die. So we're still seeing 50 and above being at the highest risk of being hospitalized and dying. So I would want to go there, but I also would want simultaneously to start doing some of our essential workers. That would include, obviously, police, teachers, and so on. Then we can move on to others. But to me, that would be my best case scenario as we move towards the age groups. In our area, moving down to like a 55-50 area age group will also take into account a lot of the people that have chronic medical conditions. The EOHU area has a higher percentage of people, particularly in that age bracket, that have they're at risk or at high risk, high blood pressure, diabetes, and so on. So by moving it downwards, we're not only looking at the risk of people, addressing the risk of people hospitalization, but we're also addressing the individuals who have comorbid conditions as well at a higher proportion in our area because of the disproportionate numbers that we have.
And sorry, I just want to make sure that I get. I guess you're saying because the pharmacies are at 40 plus, but you're saying in the provincially run or in the health unit run programs, you want to get those groups out there. And is there any concern about being more mobile, I guess, in the way that you do vaccine delivery, or is that something that you guys sorry if I'm coming from a place of a little bit of ignorance there, but is that something that you guys have already been able to move into tackling? Yeah.
Oh yes. As a matter of fact, we have a tremendous mobile team with our EMS partners. As a matter of fact, we did all of the retirement and long-term care homes, and last week, and actually up until today, we've done 10 10 congregate settings in terms of group homes and so on. And we're actually in the process of doing another 11. And we're actually doing homebound patients as well. Last weekend, they did 35 homebound patients. So yes, we do have mobile clinics. We also will be doing drive-through clinics. We'll also be doing a whole slew of pop-up clinics in areas that we don't have our mass immunization clinics.
Thank you. Next question, Bill Kingston, Cornwall Newswatch. Please go ahead.
Hi, Dr. Paul.
Hey, Bill.
Hi. I just want to ask you a question about yesterday's county council meeting. MPP Jim McDonnell painted a real picture of people making appointments for AstraZeneca vaccine at local pharmacies and then not showing up. And I just wanted to and then we hear from people from the public telling us, listen, we've been waiting to get a vaccine. We've heard of places like Cornwall's Pharmacy taking people without an appointment, and there's been huge lines up. So where do you see things? Do people want AstraZeneca, or is there hesitancy here?
I think there was a bit of hesitancy, but I think that was erased when we brought it down to 40 plus. So I think that made a difference. I'm encouraging people to take whatever vaccine they can. Like I said at the county meeting yesterday, we were not involved with the allocations. I don't even know how many they've given. I'm trying to get that information because it'll help me. But I don't think that at this point there will be as big an issue because we moved it down 15 years, and there are going to be a significant amount of people. My suspicion is that I know that some of the pharmacies, goes in and goes out. So and I also know that the other thing too is that the AstraZeneca supply, we're not sure how much more we'll be getting. So I'm frustrated in the fact that again we only have 6 in our area compared to others. And so I know that there is a will to give it, but I think that they're waiting for the next supply. They've sort of run out now. So, but you're right, there was some hesitancy before, but not as much, not very much, I don't think. But now with the 40, I think that's been erased.
Do you think there's been some vaccine shopping though?
Probably, but I don't think that a 40-year-old has any other choice, or a 50-year-old has any other choice, or a 55-year-old, because we don't have. If you don't have any other criteria, there's no choice at that point. There may be some shopping, but I can tell you, Bill, I'm pleasantly surprised. Not surprised. I'm happy about the fact that we seems that we have a very, very big demand for vaccines in our area, and I think that our area needs to be protected because we do have high rates of chronic disease, and we're seeing now the individuals that are in hospital who are younger than 60. Most of them have underlying chronic medical conditions, and so I've always worried about our area about that, and that's why I'm anxious to start going down some of the age groups. We're getting the 60-year-olds, and by as we're getting the 60-year-olds, I would bet you that a lot of them have a higher rate of those underlying medical conditions that we're getting anyway, and that's why I answered the CBC before that I'm anxious to go 50 plus. We're probably going to go 55 then 50 because that will then again cover a overlap into others who have at-risk conditions as well at the same time.
Okay. And just a quick follow-up. I know it was only last night. Has there been any movement on the OPP and the Alexandria protest?
No, I have not had a chance to speak to the commander. I've been busy today, but I will call him to see what's going on there.
Okay, thank you very much.
You.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hello, Dr. Paul.
Hi.
I was just wondering, my mother is currently eligible to receive the AstraZeneca vaccine in Kanata, and she is refusing to for the time being for some reason because my grandfather received the AstraZeneca vaccine in the UK, and immediately afterwards he was diagnosed with polymyalgia and diabetes, and I was wondering whether if the AstraZeneca vaccine could trigger illnesses
Not that I know of. Certainly not diabetes. That I can tell you.
Okay, I will be sure to tell her. Thank you
Okay.
so much.
You're welcome.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Merci.